Good morning, everyone. I'm Gustavo, and I will talk about of the disorders of fluids and electrolytes maintenance intravenous fluids in acutely ill patients. So, for this treatment, there is a treatment. We have the definition. In the definition, we have that a critical aspect of the care of acute ill patients is the administration of intravenous fluids. The intravenous fluids may be required as a bolus infusion for resuscitation or has a continuous infusion when a sufficiency in fluids cannot be ingested orally. Okay, so we have for example of use. The intravenous fluids can include, for example, dextrose and electrolytes, such as sodium, potassium, magnesium, and carbonates, for example. Okay, so we have a video to understand better the definition.
This is a short presentation explaining how the NICE guidance on intravenous fluid therapy will be implemented at the Great North Children's Hospital. We're going to first look at complications of inappropriate or unmonitored IV fluids. We're going to look how the guidelines try and reduce these complications. And we're going to explore how we plan to implement the guidelines. When poorly in hospital, children's electrolyte balance and fluid balance can be affected, and problems with abnormal electrolytes or problems with fluid overload and hypovolemia can be made worse by inappropriate or unmonitored IV fluids. Electrolytes of particular importance are potassium and sodium. There have been recent patient safety alerts because rapid changes in sodium have resulted in neurological injury and death in children, and inappropriate intravenous fluid therapy has contributed to these adverse events. The NICE guidelines state that for maintenance fluid, initially isotonic fluids, which in electrolyte composition most closely resemble normal human blood, should be used. Potassium should also be added routinely unless there's a contraindication, like renal failure. Use and ease should be monitored daily to guide fluid prescribing. However, for lots of reasons, children might need alternative fluid prescriptions. If this is the case, decisions will be led by the responsible medical team. Unless deemed clinically inappropriate, weight should be monitored daily and any changes noted. Fluid balance charts should be updated with running totals and also daily totals and overall fluid balance. As well as raising awareness through this video, we will also be adapting fluid charts to try and help keep within these guidelines. The new IV fluid prescription charts now contain an area where maintenance doses can be totaled, where alternative fluid plans can be justified if necessary, as well as the normal space to write a prescription. If rates of fluid administration or type of fluid is not in keeping with the guideline, for example, fluids with different saline or potassium concentrations are used, the justification can be now clearly documented on these charts. In addition, fluid balance charts now have an extra section where weight can be recorded and compared to previous days to look for any differences or fluctuations in weight, and prompts to calculate daily fluid balance have been made clearer. In summary, 0.9% saline fluids should be first line, and fluid prescription charts should explain why this isn't the case in certain situations. Please ensure that weights and fluid balance totals are kept up to date and checked regularly. Applying the guidelines by using these interventions should help ensure the safety of children on intravenous fluid therapy at this hospital. Thanks very much for listening.
Now we have the other point that is the applications in medicine. The applications in medicine that is important to know that the goal of maintaining intravenous fluids is to preserve the extracellular volume with the maintaining a normal electrolyte balance. An appropriate maintenance fluids provides the adequate quantity of both water and electrolytes to ensure good tissue perfusion without causing complications related to fluids overload or a volume depletion. Okay, so we can use this therapy in cases of hypernatremia, volume replacement, hypovolemic shock, hypertonic dehydration, tract maintenance, energy input, and hyponatremia or hemorrhagic shock. Now, we have the next video to understand better these applications.
Hi, my name is Dr. Janet Velasquez, and today we're going to talk about administering intravenous IV fluid therapy. As many of you already know, this type of therapy will require a provider with prescriptive authority, such as an APRN, a PA, MD, or a DO, to initiate the order, and then it will be carried out by you, the registered nurse. So, does this mean, as registered nurses, do we need to know what each IV fluid is for? Absolutely. Remember, we are the last line of defense. Even if a provider orders an erroneous prescription, it is your responsibility to detect it and to correct it before it can reach our patients. So, let's talk about the three main types of crystalloids you may be administering. You have isotonic, hypotonic, and hypertonic solutions. Isotonic solutions have an osmolarity between 275 and 295, which is similar to that of plasma. This type of fluid is distributed in the intravascular compartment without affecting the cell. These solutions are predominantly used to treat fluid volume deficit. Before we administer any solution, we need baseline vital sign, and a baseline head-to-toe assessment. So, what are some signs and symptoms of volume depletion? Well, they would include decreased skin turgor, cold, clammy skin, tachycardia, a weak, thready pulse, hypotension, tachypnea, flattened neck veins, and oliguria, to name a few. Some examples of isotonic solutions will include 0.9 sodium chloride, which is also called normal saline solution, lactators ringers, which is also called LR, and 5% dextrose in water, which is also called D5W.
Now we have the pros and cons of this part of this therapy. So the pros is that they are fast acting because they not need to cross the first step phenom that is, for example, for the oral treatment. Now we have that many presentation for different pathologies. There is difference in case of a gastrointestinal problem or, for example, a shock problem. No? They are cheap compared to other hemodynamic replacement therapy. That is another pro. So we have the cons. The cons is that the aggressive hydration with crystalloid solutions such as 0.9% saline can worsen interstitial edema and lungs function. Now we have that the colloidal solution, both semisynthetic and human albumin, could appear as an attractive alternative, but there is a little evidence of a superior clinical trials. Now we have another video to understand better the pros and cons of this therapy.
This video gives a brief introduction to the various types of fluid available and explains how fluids are administered. It is intended to help you understand how to select appropriate fluids and the practicalities of fluid delivery. Broadly speaking, fluid administration falls into two main categories: acute fluid resuscitation and maintenance fluids. Acute fluid resuscitation is required in acute cases of hypovolemia. For example, hemorrhage, severe diarrhea and vomiting, burns, or sepsis. Typically, large volumes of intravenous fluid are required to boost circulating volume. In these cases, prompt fluid delivery can be life-saving. More controlled maintenance fluid administration is typically required in patients unable to maintain adequate oral intake, for example in cases of bowel obstruction or for surgical patients in the perioperative period. This maintenance therapy replaces ongoing fluid losses and maintains hydration. There are three main types of fluid you will encounter on the wards: crystalloids, colloids, and blood products. Crystalloids are solutions that contain small molecules that can easily cross cell membranes. Examples are 0.9% sodium chloride, also known as normal saline, Hartmann's solution, and 5% glucose or dextrose. Normal saline contains 154 millimoles of sodium and 154 millimoles of chloride per litre. Bags of normal saline that contain potassium chloride are also available. They typically contain 20 or 40 millimoles in a 1 litre bag. Hartmann's solution contains 131 millimoles of sodium, 5 millimoles of potassium, 2 millimoles of calcium, 111 millimoles of chloride, and 29 millimoles of bicarbonate in the form of lactate. These are all per litre. Hartmann's solution is more closely related to the body's normal composition than normal saline.
Now we have the applications in Ecuador. Now we have the applications in Ecuador. In the case of Ecuador, same that other parts of the world, we have that this therapy or this maintenance intravenous fluids are used to provide a critical support care for children who are actually ill. IVF, that is the intravenous fluids, are required if sufficient fluids cannot be provided by using enteral administration for reasons such as gastrointestinal illness, respiratory compromise, neurologic impairment, a perioperative stage, or being moribund from an acute or chronic illness. Okay. Now, finally, we have the conclusions. In conclusion, we have that many adult hospitals in patients need intravenous fluids therapy to prevent or correct problems with their fluids and or electrolyte status, deciding on the optimal amount and composition of IV fluids to be administered and the best rate at which to give them can be a difficult and complex task, and decisions must be based on a careful assessment of the patient's individual needs. Thank you.